Hello everyone, you are listening to Dr. Zahra and OBGYN on the Dr. Zahra's Medical Advice podcast. In the previous episodes, I talked essentially about cancer screening and prevention, but there is another big part of my specialty, which is obstetric. Obstetric is related to the care and treatment of women in childbirth and during pregnancy. In this field, I choose to talk about a frequent disorder nowadays due to junk food and bad lifestyle habit, gestational diabetes. Gestational diabetes is diabetes which is diagnosed for the first time during pregnancy and that resolves after. Gestational diabetes doesn't cause noticeable signs and symptoms except an increased thirst and more frequent urination. But there is a screening test performed between 24 to 28 weeks, and that's how we usually diagnose gestational diabetes. It consists of drinking 100 grams of glucose and then check your blood sugar level 1, 2 and 3 hours later. If it's higher than 180 the first hour, 153 the second, or 140 the third hour, you are diagnosed with gestational diabetes. We don't know yet the exact cause, but there is a lot of risk factors, such as a family history of diabetes, overweight or obesity, a previous gestational diabetes, or a lack of physical activity. Gestational diabetes can cause complications that may affect you or your baby. For the mother, it can cause a high blood pressure, it can increase the risk to have a C-section or future diabetes. For the baby, we can have an excessive birth weight, an early birth, or serious breathing difficulties. Diabetes and obesity later in life. That's why it's important to keep your blood sugar level under 0.94 while fasting and 120 2 hours after a meal. How to keep your blood sugar level correct? First, you should start your pregnancy at a healthy weight, losing your extra weight before. Then, don't gain more weight than it's recommended by keeping a healthy diet. Eat more fruit and vegetables. Moderate the amount of lean proteins and healthy fats. Moderate pasta, rice, bread and cereal, and certain vegetables such as corn and peas. And avoid foods that have a lot of sugar, such as fruit juices and pastries. By keeping a healthy diet during your pregnancy, you will prevent the complication and keep your baby healthy. Thank you for listening, dear auditors. Take care of yourselves and goodbye.